Pod listeners. I am one of your hosts, Diana.
And hello, everyone. I'm your co-host, Mikhail.
And welcome back to the fourth episode of Speak Out, a podcast series that aims to teach the LS community and Speed's partner communities more about the disability sector. And if you're new here, please do check out episodes 1 to 3 here on Spotify and YouTube.
So, here in this podcast series, our invited speakers will delve into their stories and experiences involving the sector. The project aims to embody the value of inclusivity and become an avenue for different stakeholders to have a genuine discussions about issues in the sector.
For last week's episode, we were honored to hear from a parent of an adolescent with disability as we discussed the experiences and perspectives of our friends in the sector who are going through puberty. In today's episode, we'll be talking about one of the most pressing concerns for persons with disabilities, healthcare. Since the onset of the pandemic, the healthcare system of the country has affected them in various ways. In order to know more about this, allow me to welcome the presence of our guest for today, Dr. Alberto B. De Leon.
Hello, good afternoon. Diana, that's Albert, not
Ah,
Alberto.
okay, Albert,
Yes. Good
sorry.
afternoon, everyone. Thank you very much for inviting me to this podcast. It's my pleasure to exchange information with you regarding disability.
Thank you so much, Dr. Albert. So, for everyone who doesn't know, Dr. Albert is the advisor of Handicapables Association of Tuguegarao City and is the medical director of Dr. Domingo S. De Leon General Hospital in Tuguegarao. So, we are honored to have you here, Dr. Albert. And thank you so much for accepting our
It's
invitation.
also an honor and privilege to be part of your program.
Yes, and since this episode's theme is access to healthcare, we would like to ask you questions about the general experiences of a person with disability working in the health.
Yes.
So I'll give the floor to Viana.
So, Doc, we are curious as to what field or specialization are you currently working in?
I'm a general practitioner. I did not go into specialization, although most of my patients are in the adult and elderly. And I'm also concurrently the medical director of the family-owned hospital, which has operated since 1969 and started by my father. I just continued the what he started. Actually, we are now on our 52nd year of operation.
Oh, congratulations po, sir, on
Thank you.
that.
A long time. For the next question, I was wondering if there are any preconceived notions against doctors slash healthcare professionals with disabilities, and if there is, what were some of that you
Uh,
encountered
I,
personally?
uh, Actually, when I applied for medicine proper, the training officer who interviewed me actually asked me, seryoso ka bang maging medical student given your disability? Kasi we would not like to, for another medical student to lose the opportunity. You might quit along the way. I told the training officer, no, sir, I made up my mind. I wanted to become a doctor and I'm already here. I will push through and I'll pull through.
So inspiring, doctor. I mean, there's really a stigma between people with with disabilities. So I think it's really important that there's representation in the healthcare field.
Mm. And
Yes. And
uh,
then usually the disability is seen first before the person. It's like me, so they prejudge me that I might not be able to finish medicine given my disability because admittedly, taking up medicine is not easy. It's not just all books, it's not just all lectures. It's going to be duty hours in the hospital, duty hours in the clinical areas. So probably the training officer was concerned about that. And luckily, I was able to convince them that the slot given to me is for me and not for anybody else.
I see, I see po, Doc. But aside from that, we are more interested in your experience in medical school. Were there any highlights or memorable experiences?
Well, when I was studying, my disability was never a problem with my classmates. As a matter of fact, I had classmates who imitated the way I walk. Before I used the wheelchair, I was able to walk using the cane. Although at the time that I was studying in medicine, I was only using a walking cane. I did not use the crutches until I was in third year and fourth year. So they imitated me the way I walk, and it was for me not an insult, rather a compliment. As a matter of fact, when I graduated from the UST College of Science from my BS Biology, we formed a line. I started the line, and they followed me the way I was walking up to the parking lot. That was an unforgettable experience. And when I was already in the medicine, there were four of us who were persons with disability in our class. And again, before we graduated, sabi nila, Albert, ba't hindi tayo magkarera kayong apat? So we had the race around the quadrangle of the third floor of the medicine building. And then I won the race. I defeated three other classmates. If you are familiar with Nonoy Zuniga, he was a classmate. We were classmates in third year.
Oh,
So
congratulations. I sorry.
for me, that was not insult, an insult. As a matter of fact, for me, it was an acceptance that despite of my disability, I had classmates who are not only friends to me, but were brothers and sisters as well.
That's very good to hear po that you had a positive experience. And congratulations po on winning
Yes,
the
another
race.
challenge when I was studying, whenever the elevator was not working, imagine during my BS biology years, that we were standing at the main building. There are 98 steps from the first floor to the fourth floor, which I painstakingly take or climb when the elevator is not working. When I was studying, I used to have a trolley where I place all my books. So I pull the trolley as I go up. And by God's grace, there were people who helped me, even though they do not know me, but they are studying the same building.
Was there a ramp po to pull your bag or what? Oh,
During that time, there was no ramp, just the elevator. And the UST Medicine building, the elevator is old. It's not modern, so gets out of order most of the time. So I have to climb up to our laboratory was in the fourth floor then, so I have to climb up to the fourth floor just to attend to my laboratory classes. The same with my experience during the medical school. Most often the elevator is not working, so despite of that, I have to climb because I have to go to my class. And thanks God, I was able to finish 8 years of academic studies in at UST.
so nice to hear po. And um, another question po. Are there
Yes.
aspects of the healthcare system that are discriminatory towards the persons with disability community?
Well, number one, if we're talking about the discrimination, there is discrimination. First off, the infrastructure. Not all hospitals are PWD differently. Second, not all persons with disabilities are financially stable. Actually, most of them are in the indigent sector. So it's very difficult for them to access healthcare. They need to have money to access healthcare. And that is the biggest challenge. Disabled ka na nga, magkakasakit ka pa. Pag nagkasakit ka, wala kang pera, ang hirap pa pumunta sa ospital. And another thing, there is not much program in government that will provide free medicines, free disability walking aids or wheelchairs to all persons with disability. And hopefully, with the universal health care that is now being rolled out by our government, there's a provision there providing for more benefits, field benefits for persons with disabilities. Hopefully, things will improve as the years go by because the universal health care is now in its pilot implementation, and hopefully by year 2025, it's going to be a full rollout of the program.
Yes, sir. I agree po. I think this is also the problem with mga third world countries like the Philippines, is there
Yes.
like a lack of access to facilities
Yes.
and insurances for people with disabilities. So I think
Yes.
I would like to ask, what are, like, aside from the current solutions, what are like necessary, are there any solutions or actions that you think can help with regards to catering people with disability in the healthcare system?
First off, it's important to have a comprehensive database of persons with disabilities because government cannot come up with a policy with programs and activities geared towards persons with disabilities unless there is a clear picture how many are the PWDs or persons with disabilities in our country and what segment of the society do they belong. Without the database, it will be very difficult to come up with a focused programs, projects, and activities for persons with disability. So that is what is supposed to be the immediate action that the government should take. And the Department of Health has already rolled out a persons with disability registry, but the problems with the internet connection is posing a roadblock towards the completion of the database for persons with disabilities, which again will be very important once they roll out the free PHIC for persons with disability that is incorporated in the Universal Healthcare Program.
Thank you so much, sir, for sharing all of your insights regarding this.
You're
And
welcome.
and that's a wrap for today's Speak Out episode on access to healthcare. To our speaker, Dr. Albert De Leon, we thank you for joining us for today's episode. Not only did you give some of your experiences and perspectives on the matter, but you also shared with us your passion and dedication for the sector. We hope you enjoyed your time with us today. And to our listeners, we hope that you had fun listening and gained wonderful insights from today's episode. But don't worry, for all of you who are interested in hearing our future episodes, we are available on YouTube and Spotify. So feel free to listen there if you want to hear amazing and insightful stories like this from the sector. Thank you and have a great day.
Thank you for
Thank
watching.
you. Thank you very much for inviting me.